who needs the vaccine right now and why should they get it?
So the people for whom the recommendation was made was for people with underlying medical condition or those that are at risk of complications and hospitalizations. That means those 60 years and over, those with underlying medical conditions that, they should know that they're at risk or discuss it with their pharmacist or their physician, and those with immunosuppression. So these people really have to go now to get their vaccine as the virus is starting to circulate more broadly. We're also including in there healthcare workers because we're aiming to try and limit the spread within our workforce so that we're able to take care of our patients.
Thank you so much. And may I also ask, what will be done to convince the people that for their need to get this vaccine? How will you convince people to get it?
So I think that that's really the role of the first line, so physicians, pharmacists. I understand that people might be tired about getting a vaccine, but it's really similar to influenza. So we start a new season, we have new viruses circulating, there's a vaccine that has been updated for what's going around. I think now is the time to get it because the last thing we want is for those people to end up being admitted. And usually what we see is that that group is actually pretty good at getting their vaccine. And for the others who are going to have a cold if they catch COVID or a cold if they catch influenza, it's okay to, not get vaccinated as a first mean. What we really want for everyone in terms of limiting transmission is respiratory etiquette, which means regardless of the virus that you have, if you have fever, a runny nose, cough, whatever, you try to stay away from others. If you have to go out, you wear a mask. What Dr. Boileau was saying, cough in your elbow, throw out your tissues rapidly and then wash your hands after manipulating your respiratory secretions is what is going to be most helpful because we don't want transmission of COVID, but we don't want transmission of RSV, influenza, enteroviruses, tons of other viruses for which we might not have a vaccine yet. So it's just, take this as a syndrome. We don't want respiratory viruses to be transmitted, full stop.
Merci beaucoup. And just a very quick clarification to confirm. So right now, as of next week and October 2nd, it was going to be the Moderna vaccine that's available to all. And what we just found out right now, the Health Canada Pfizer vaccine, this is going to be distributed in the next few weeks. Is that correct?